Good day, everyone. Welcome to my channel. My name is Dr. Ogechi Sylvia Eze. You're welcome again to Health and Music with Dr. Eze. In this month of February, which happens to be Heart Health Month and Black History, I wish to talk about palpitations. I have done previous videos that cover some areas of cardiology. For example, I've taught about heart attacks, both in English and Igbo. I've also talked about pulmonary embolisms. So today I'm going to talk about palpitations, and I'm going to cover the following topics: the definition of palpitations, causes of palpitations, diagnosis, the examinations that you should expect to have, as well as management. So that will be the areas that we would cover. I will do another video like this in Igbo to appeal to my Igbo audience, and I hope you enjoy it. Okay, so what are palpitations? And you might wonder, why palpitations? So palpitations can be defined as, I'll be looking at my notes, I have made some notes, abnormally perceived heartbeats. Some people describe it as an uncomfortable awareness of their heart rhythm. Normally, you shouldn't be aware of your heartbeat. The heart starts beating right from when we are in the womb, and then it keeps on beating until the day, the minute, the second that we die. Now, the heart is a muscular organ, so you can imagine it just keeps on beating. The normal heartbeats, which I believe we learned from primary school, is lub-dub, lub-dub, lub-dub. So regular, and what we call in medicine sinus rhythm. It's so anything that is out of is an irregular heartbeat. And when you become aware of that irregular heartbeat, that is palpitation. What are some of the causes of palpitations? So it could be due to structural abnormalities in the heart. The heart is a muscular organ and it should beat like that regularly. So if there is a sort of dead portion of the heart, let's say from a previous heart attack, or a congenital abnormality, a structural abnormality from birth, it can cause the heart to, instead of beat regularly and symmetrically, it could be beating, the dead portion could be beating off on its own. Then you could also have emotional or psychosomatic causes. For example, somebody who is anxious might have a very fast heartbeat, somebody who is depressed, or somatization, which is imagining, or if I should say, having perceived illnesses that no other person can detect. So we've talked about structural abnormality, we've talked about psychosomatic like anxiety, then systemic causes. For example, somebody who has got an illness like an overactive thyroid can cause very fast heart rate or irregular or palpitations, or somebody who has got anemia. You could also find palpitations in menopause, in pregnancy, high temperature, fever as well. So that is number 3. So structural, psychosomatic, systemic conditions, drugs. For example, the asthma inhalers, overuse of it can cause palpitations. And then recreational drugs like cocaine, some antidepressants, some types of antibiotics. And that is why you don't just go and buy any antibiotic. You need to come and see a doctor who can find out, could you have an underlying heart abnormality that can make you predisposed to reacting to certain antibiotics. So we've looked at the causes. Now, diagnosis. When you come to see me or see your own general practitioner and tell them, doctor, I'm having this strange feeling. It's like my heart wants to run out of my chest. It's like my heart is pumping faster. Some people can come, for some people, it could feel like a gnawing or a numbing kind of feeling. And I will start by asking you questions. I would ask questions like, what triggers it? For example, exercise. And if you mention exercise, that's a red flag and it could make me quite concerned. So what triggers it? And how often does it come? And when it comes, how often does it last? That's question number 3 I would ask. And what is the nature? For example, I could tell you to tap it out. And that's why I tried to use clapping, which I did at the beginning. that's regular. So if somebody's having, that's what you call an irregular heartbeat. Or if it is, that's a irregular heartbeats. So those are the questions that your doctor, you should have the answers to them. You shouldn't feel what type of questions are this. And then I would also want to find out from you, what are the associated symptoms you have. For example, do you feel short of breath with it? Do you get any chest pain, or do you feel like you want to pass out, feeling faint? Now, in taking history, we also want to find out about your personal history as well as your family history. Is there any history of sudden death in the family? Is there any history of ischemic, of a previous heart attack in yourself or in your family? And then I also want to find out things about, have you got any other associated medical conditions like diabetes, hypertension, and what is your weight? What is your cholesterol? So when I choose to examine you, so this is just to prepare you for what your doctor might want to do. With my stethoscope, I would want to, so first of all, I'm going to look at you. Are you looking pale? Are you looking underweight? Because pallor could point to being anemic, and being underweight could point to something like an overactive thyroid. And then, so general examination, and then I'll take my stethoscope and I will listen to your heart. The heart is on the left side. I listen to the four should I say, cardinal points in the heart, which are the aortic, the pulmonary, AP, the tricuspid, and then the mitral, which is right under the nipple. Listen to those portions. And then when I listen, I'm also going to feel for the pulse myself. You've told me, and now I'm examining. Feel for the pulse. Now, after listening, feeling, I'm also going to listen to the heart to be sure that they are up to the lungs, to be sure that there is no fluid in the lungs. For example, a patient with heart failure could have fluid collected in the lungs. Now, once I do all of this, I will do a bedside ECG, which is another thing you should prepare yourself for. The doctor will tell you to get behind the screen, undress. If you prepare to have a chaperone, please request a chaperone for. You should always have a chaperone for intimate examinations. And then we're going to put some leads like sticky tapes on your chest. The purpose of an ECG, which means electrocardiogram, is to detect the electrical activity of the heart, because the heart is all about electricity. If we find any abnormal readings, we need to think of how we're going to manage them. Okay, now, what is the management for palpitations? If a person comes into my clinic and has mentioned that they have palpitations, and at that point in time, they are also feeling short of breath, getting chest pain, feeling faint, I'm going to call an ambulance for you. This is so as to ensure that you are in a clinically stable environment where you can be managed. The reason is because with chest pain, it might be that there is also a coexisting heart attack happening at that point in time. A shortness of breath could mean that it might be a pulmonary embolism. Who knows? And feeling faint is also a red flag. You need to go into hospital. I cannot manage you in my clinic there and then. If this is a palpitation that has happened sometime in the past and you're feeling stable at this point in time, then what I would want to do is to do some blood tests for you if you're feeling stable. If your pulse rate or your heart rate is very fast, provided you have no risk factors, I can at that point in time give you a medication to reduce your pulse rate, provided I've got recent blood tests for you. And now, how can we prevent palpitations? Lifestyle changes. If you're hypertensive, please make sure you're taking your blood pressure medicines to keep your blood pressure in the target range. Usually anything below 140/90 for people who do not have coexisting kidney conditions or previous heart failures. For people who have got previous kidney conditions or who have got previous heart failures, we would usually want it to be less than 135/85. Okay, so manage your blood pressure well. Try and lose weight. More body mass means that the heart has to work faster. So anything that makes the heart pump faster to circulate blood around can make the heart start pumping irregularly. The heart needs to be in a relaxed atmosphere to pump regularly. Relaxation, sleep well, and then The most important reason why we try to detect palpitations, or why we try to investigate palpitations, is that a person with palpitations, if we find out that there is an abnormality in the heart's structure or in the pumping, such a person could be at risk of strokes. Such a person could also be at risk of heart failure. Now, if you imagine that the heart should be pumping regularly like that, the heart is like a balloon, you're pumping. It is pumping blood at a regular rate, and it's allowing the blood to flow smoothly. If the heart, for any reason, starts, maybe one portion is pumping regular and the other portion is slower, blood can pool in that section and it can form a clot. If it forms a clot and the heart pumps it out, it could go through the vessels into the brain and give a stroke. Or it could go to the distal organs, to the distal parts of the body, like the limb, and can give you what we call gangrene, or it could give an ischemic condition whereby blood flow to that portion of the body is cut off. It could also form an embolus, which is what I discussed in my teaching on pulmonary embolism. So if at any point in time you notice you're becoming aware of your heart beats, it's uncomfortable, it's painful, please try and see your doctor early so that you can have investigations done in time. And I hope I've been able to explain to us what palpitations are, what to expect when you go to see your doctor, how we can prevent them, and the importance of investigating palpitations early. Thank you so much. If you have any questions, put them in the chat box below. Have a beautiful day. Bye bye.